pelvic organ prolapse is a common condition in women. This occurs when there's a lack of support holding up the pelvic organs. This lack of support can occur in one or more than one area. Women bothered by symptoms of pelvic organ prolapse will often describe a sense of a bulge in the vagina, or feeling like they're sitting on a ball, or the feeling that a tampon is in wrong. This is what normal anatomy looks like with the organs supported. The pelvic floor muscles provide some support for the pelvic organs. There are also supporting structures from the cervix at the lower part of the uterus to the sacrum, or the tailbone, at the bottom of the spine. These provide support for the vagina, which in turn then provides support for the bladder, the uterus, and the rectum. Lack of support can occur in the front wall of the vagina, the top of the vagina, or the back of the vagina, or it can occur in any combination of these three areas. If support of the front wall of the vagina is lost, then the bladder pushes the front wall forward, and we call this a cystocele. If the back wall of the vagina has lost its support, then the rectum pushes the back wall forward, and this is called a rectocele. If support has been lost at the top of the vagina, then the uterus can drop down, and that is called a uterine prolapse. If a woman is postmenopausal, meaning she has stopped having her monthly periods, then the lack of estrogen from the ovaries can contribute to prolapse symptoms due to the change in tissue quality of the vagina. Using some vaginal estrogen can be very helpful to improve these symptoms. She can also be taught to do Kegel exercises or pelvic floor strengthening exercises, which can also improve the prolapse symptoms. A pessary can also be used to support the prolapse. A pessary is a medical device that folds in half, is inserted into the vagina, and provides support for the prolapsed organ or organs. If these treatments are not helpful enough, then surgical correction of the prolapse can be considered.